Number one complaint that I get from denture patient is dentures are loose. Therefore, they can't chew properly because denture moves all the time. And then the second thing is they complain that they can't get used to it because it's something big, very uncomfortable. So they come and ask me the questions such as like, well, how can I improve this? Is there any different things besides what I have? We look at the CT scans and then make sure, look at the quality of the bone and then see if the patient is qualified for dental implants. And once we know that the patient is qualified for dental implants, then I give the patient the options of either implant supported denture or we call it fixed hybrid dentures. Over denture options talk about is a lot of people call it snap-on dentures. So the implants are placed into the jawbone. We wait about 3 to 4 months, that's what I always say. And then once the implant is integrated to the bone, and then we convert that dentures, there's like a little clip that we add on to the dentures, so and then patient can use that. And then if patient wants something more, because you still get a lot of the discomfort because dentures are bulky, you can still have sore spots, you can have like dentures can rub against it. So if they don't like that option, then we suggest that dental implant hybrid. Very similar to dentures, but these are, everything stays above the gum. The bulkiness is not there. We use about 4 to 6 implants. Nowadays we use more. Sometimes we like to put as many as we can. It gives more security. It gives more functionality to the patient. And then once these are secured in, you use it almost like your natural teeth. Your eating is much better. Your speech is much better. A lot of patients, they like to go out there and recommend these procedures to their friends and families because it changed their lives. And that's the life-changing experience. That's what we like to offer to our patients.